Hello, my name is Chris Higgins and I'm Chief Transformation Officer here at LPFT, and we're hoping that you'll be able to help us with a piece of work that we're doing as an organisation to help really bring our strategy to life and really help us support people to live well in their communities, particularly from a mental health and well-being perspective. So I've got a number of slides I just want to run through, but this forms part of our engagement as an organisation, and we're hoping you can really contribute to that, and we'll put details at the end in terms of how you can get involved. So first up is our trust strategy that we refreshed last year, and we've maintained our vision as an organisation, which is we really want to support people to live well in their communities in all sense of the term, but obviously as a trust, we're particularly interested in that helping people's mental health and well-being, which I'll explain a bit more out as we go through the slides. Our strategy got 4 key elements to it. 3 are quite familiar to us as a trust, which are providing outstanding quality in the services we provide, having outstanding people deliver those services, and making the best use of the resources that we've got available to us. But in this new strategy, we've got a 4th element, which is quite new for us as an organisation, which is to really support the health of our population as a whole. So not just focusing on the people that are referred to us as a provider, but also everybody in our communities and what role we can play as an organisation in really helping people to live the best life possible. So we've been thinking about this as an organisation, and we've been looking at how changes are happening in the NHS around us, what we're trying to achieve as an organisation and how we can best do that. And we've come out with a bit of a position as an organisation about where we want to set ourselves out and how we want to position ourselves as an organisation going forward. And that's to act as more of a system leader and custodian really of mental health and well-being in Lincolnshire. And what that's signalling is us really stepping into that space of taking responsibility for population health as a whole and really seeing ourselves as an important role to play in population health, and with that particular focus around mental health. We also provide services for people with a learning disability, those with dementia, and for our autistic community, and that's really important that we continue to work in partnership with other organisations who really take the leading role in those spaces, but obviously we've got an important role to play in that space as well. So as we've looked at that and we've considered what our role should be, we've come up with 2 key areas that we think we should focus on as an organisation, and that is to continue to provide high quality specialist mental health services. That's something we've done historically as an organisation for some time. That's part of who we are, and our role in the system is we provide that specialist care and treatment when people need it. But we've reflected as an organisation that actually to really help people to live well in their communities, we need to do more than just provide specialist healthcare, which I'll come on to in a minute. But that means really supporting people with those other things that really matter to people: a safe place to live, social networks, employment, that we know are really fundamental to somebody's mental health and well-being. Now, as an organisation, we're doing some really good things. We're rated as good by the CQC, which is obviously where we want to be, but obviously pushing for that outstanding status that we would like to get to. And through a continuous process of improvement and looking at our services about how we can improve them and make them better, we're always looking for ways to improve that, but we're at a good starting place. That said, there's lots we can do, lots more to do in this space. So we know that there's a number of areas where we're not quite getting this right. So some people are waiting too long for services, which is not what we want at all. There's sometimes people in hospital who probably could be better supported in a community setting. We've got some people having to travel far away for treatment and having, going outside Lincolnshire to access care, which is not always appropriate for everybody. Sometimes we're not as clear as we should be about how efficient our services are or how effective they are, and we haven't got the right consistency time. So what I mean by that is that we've got some things like we've got an urgent assessment centre and a clinical decisions unit in Lincoln. We haven't got something in the south of the county in Boston or Grantham areas, for example, and that feels unfair in terms of how services are provided across the county. We also know that sometimes our staff and patients don't feel as safe as they should do. And again, that's something we really want to address. So whilst we're a really good organisation and we've got lots of things to be proud of, we know there's more that we really need to do, and we want your help in and working out what we should prioritise. So for that's this kind of specialist services thing that we provide and the role that we play. But from a wider healthy population perspective, we want to really understand what it would take to really help people to live their best lives, to tackle those inequities and inequalities that exist for the people that we're here to support, how we can better support the economic development of our county as a large provider and a responsibility to be a big employer in the patch. What more could we do to help our communities? And ultimately, if we can support people to live well and maintain the best health possible, can we reduce the number of people that then go on to need specialist care and services in the future? And that's something we're really keen to explore. Just to get a bit of context on when we're talking about those wider factors, there's some quite well-known evidence out there, and you can Google this and find it for yourself, is that the things that really affect people's health and well-being are quite broad-ranging. And what you see there is that the provision of specialist healthcare, the bit that we do predominantly as an organisation, that's specialist care and treatment, inpatient services, and doctors and nurses and other health professionals providing healthcare, only really amounts to about 20% of somebody's overall health and well-being. And that is probably no surprise. Where you live, the social networks and the friends and family around you, whether you've got a job or meaningful occupation, purpose in life, whether you've got income, whether you've got access to education, and those other factors and just the environment in which you live in are just as important, and sometimes in some cases more important than that provision of healthcare. So what we've recognised as a trust is that we can continue to provide great, brilliant healthcare, but if we don't support people with those other things that really matter to them, then there's no wonder that people's mental health and well-being deteriorates and people continue to need services in the future. So as a trust, we're really keen that we do more to support that whole range of need and think about what our role could be in that as a trust in the future. So just as a bit of an example to bring that to life a little bit, is if you've got a serious mental illness, if you're autistic, and indeed if you've got a learning disability, your chances of being employed are much less than if you were compared to the general population, and that's not great. That's something we want to improve upon. I think the unemployment rates in the general population are about just over 4%, whereas you can see there for people with serious mental illness or those that are autistic, it can be as much as 75%. So and we want to do more in that space and understand why people aren't able to access employment. Is that because employers don't see the benefits or not able to adapt services and the job opportunities for people with different needs, or is there the need to develop other opportunities for these people and that really play on their strengths? There's also a lack of supported housing. There's great housing offers and great housing providers out there doing some brilliant work, but we see for a number of people, certainly they come into contact with LPFT, is we've got people stuck in hospital who are really there because there's no appropriate accommodation for them, and that's not through the want to try, and I think through different providers, but often it's just not available in the right places in the right way that really meet the needs of the people that need it. And we see unemployment rates for people with mental illness and other conditions, and really we're thinking about that, if you haven't got that safe place to live, a place to call home, it really impacts on your mental health and well-being. We also know that the life expectancy of people with serious mental illness and those who are autistic and those with learning disabilities is far lower than the general population. And again, that's not acceptable, particularly when lots of those reasons are avoidable. Often it's access to appropriate screening for healthcare and the onward treatment not really being designed in a way that enables people to access it in a fair way and an equal way. And so again, if there's things we can do there, then absolutely we should. And we need to also acknowledge that suicide rates in Lincolnshire are higher than the national average, and any suicide is an absolute tragedy. So anything we can do to support people to live well in the broadest sense and to reduce suicide rates, then absolutely we should be doing something to support that. So this is all good in theory. We can point to the things that aren't quite right and the things that we're doing well, but it's about how do we really move that into something that's tangible, something that actually means something, what we're actually going to do to make a difference. So the two areas I spoke about that we're going to focus on, the first is that specialist healthcare delivery, and absolutely important, really crucial to the health and well-being of the population. We need to make sure we get that right, and so we need to really understand what we're doing well, what we could do better, what more do we need in different places, how do we make sure people have really fair and equitable access to really high quality healthcare services. We also, as I spoke about, need to think about how we address those wider determinants of health, particularly that mental health and well-being in our population. So how can we create opportunities for people that give them that, a friend, a job, a home. And we've been thinking as an organisation about things that we can do ourselves and things that we might want to work in partnership to deliver. And we've talked quite heavily as an organisation through our board and other places around how do we work in partnership and really see what's out there, because there's some brilliant partners out there, brilliant organisations doing some great work. How do we harness that? And also, what could we do with the money that we receive as an organisation? Could we pay others to be able to do that, who are better placed to provide some of these services? So whether that's housing or employment or whatever it might be, and we really need to think about that. So just as a bit of to kind of help shape people's thinking and to know what we're talking about here is, as an organisation, we provide lots of things. We outsource our contracts around all sorts of kind of domestic and other services, and we're saying, could we do things differently to provide opportunities for people to be employed in the organisation, particularly people with a lived experience of mental health or those who are autistic, for example? Could we as an organisation do more to provide more opportunities for people to find employment? Can we work with employers so that they can find different ways to see the benefits and the strengths in people so they feel more equipped and able to give opportunity to people? You know, can we work with our partners around housing and accommodation? Could we do something as an organisation? Could we provide something if others aren't able to do so or willing to do so for the people that we're here to support? So there's a whole range of different options that we might want to explore through this that really could shape the services for the future and offer some real opportunities for people to get the support they need. I mean, there's examples around the country. So if you look, just, you know, our neighbouring trust in North East Lincolnshire, in Grimsby, the local trust there runs the local garden centre, Grimsby Garden Centre, not only providing, you know, great opportunities for local people, economic development of the town, but great opportunities for people with lived experience to get employment, to get references, to get that confidence, to integrate with the community and meet people, and also have a bit of money in the pocket where they can then use it to choose the things that we often benefit from. And on top of that, you know, there's opportunities in that space to potentially generate surpluses, or at least make it pay for itself. So and if we could generate a surplus, we could reinvest that in more services. So there's all sorts of things that we might want to consider in this space, and that's where we really want your help to say, of all the different things and different needs out there, who's doing some great work already? What more could we do, and what could LPFT's role be in that space in the future? So we've talked about that, touched on in working in partnership and also potentially contracting others. And it's just to acknowledge that this is not LPFT trying to do everything. That's certainly not what we want to do, nor should we try to do. There are some brilliant organisations and people doing some brilliant work out there. And we just want to work with those organisations, work alongside those people to try to maximise the opportunities so that we bridge the gaps and fill the need that currently exists for some of our people. And if those partners, those organisations aren't out there for any reason, we could potentially contract others to do the same. And again, we've got examples in the trust where we've tried to do that. We pay others who are better placed than we are to be able to provide some services. But failing that, if those partners aren't there or there's nobody really contract, then LPFT may be able to step into a space and provide some of these things ourselves. So that's when you put it all together, through focusing on specialist care delivery, through addressing the wider determinants of health and working in partnership to do that and contracting others. We're hoping that we can cover off the whole range of things that really matter to people and make a difference to their overall health and well-being. And that's what this is all about, is what can we do differently to really support people in the widest possible sense to maximise their opportunities and really improve their health as much as possibly can do. So where you come in is we have got a number of engagement events that we're running, and also a survey that will be going online, available for our website. We'll put details at the end, where we really want to get your views. So on two particular aspects around specialist services and those wider determinants, which I'll touch on in a moment. But the end of this is we want to be able to describe a plan, you know, a real clear plan about how we're going to do that, what things are we going to do as an organisation, working with partners, and what we will deliver ourselves over the next few years to really tackle some of those gaps and really help people realise their maximum potential. And then from there, we'll be able to pull up a plan with a financial plan that supports that, so that we can really clearly map out the next stages in the organisation's development. So just to let you know, in terms of what we'll be looking for through the survey, is just, you know, simply when you're thinking about those specialist services that we provide and that are available in the county, what do you see as the gaps, what's working well, what additional things might we want to provide in the future, is there anything we should stop doing that we currently do, we might want to do differently or stop altogether. And just getting an understanding of where you see those gaps and opportunities is going to be really helpful to inform our plans. And similarly, if you're thinking about those wider terms of health, those wider factors that really impact people's mental health and well-being, housing, education, employment, those things. What's working well, because we know there's some brilliant things happening across the county. So what's working well, what should we really promote and encourage? What are the gaps for people to support people in our local communities? And really, what do you think could be most helpful? Because at the end of this, we're going to have to prioritise some of this work, because there's all sorts of different ideas we could do there. But what are the things you think actually these are the really things that are going to make most benefit for people, have the most impact? And that'd be really helpful to understand that. So that will really feed into our plan as we develop it as an organisation. So please get engaged, please get involved, and really look forward to receiving feedback from you.